Hi, everyone. This is Dr. Lamberson. I'm going to provide a brief explanation of one of the major assignments for NRS 502, the organizational assessment. If you click on Begin Here, Course Essentials, it will take you to the page in which you can find the major assignment overview, lesson 0.4. On that page, you can see the three major assignments in the course. Click on each down arrow to provide more detail on the assignment itself and the rubric. During this course, you will conduct a two-part analysis of a human service delivery system. This is usually based on your clinical prevention and population health clinical placement. However, it could vary dependent on the cohort and what clinical you are taking at the same time of this course. This assignment has two separate components that build upon each other throughout the course, and the idea is that you will submit the first section, receive feedback from the instructor, revise it, and then submit both part 1 and part 2 in a final cohesive document at the end of the course. You can read here how the assignment aligns with the overall course outcomes as well as the purpose of the assignment. If you scroll a little bit further, you can see the mention of the setting that you should be analyzing. It should include the larger organization in which your specific patient care setting is embedded. Some of you will have that distinction of a smaller clinical site within a larger organization, and some of you may not have that distinction. You may just be doing your clinical at one larger institution or one institution part of a larger health system. There are two parts to this assignment. Part 1, a brief background, narrative, and external environmental assessment, where you will be using a pestle table to analyze and incorporate information from that analysis into the assessment. And part 2 will include a brief internal organizational assessment and a narrative portion that reflects an evaluation and prediction of the organization or the clinical site you are at. You may use the SWOT analysis template that I've included for part 2, but it is not required. You can scroll through each of part 1 and part 2 to read about the details of requirements for each section and also review the rubric. But in brief, part 1 is a brief description and history of the organization, and then using the pestle analysis, looking at larger macro influences on the organization, such as political, economic, social, technological, legal, and environmental influences that may impact the organization. I have included a pestle analysis template that you may use, but you can create and include your own. The requirements for this part of the assignment indicate that you need to address at least 4 of the 6 domains listed in the pestle template. Part 2 is the internal assessment of the organization and your synthesis, evaluation, and prediction of the organization. For the internal assessment, you choose one of the highlighted areas on which to assess: structure, managerial subsystem, or psychosocial subsystem. And you frame your internal assessment around the prompts that are listed under each of those headings. Now, not all the prompts will be relevant to every organization, so read through each of the 3 options, decide which one is most pertinent to your organization, and then frame your narrative discussion and your internal assessment around that perspective and that subsystem. Lastly is the evaluation prediction, and this is where you identify areas of observed and planned change that is based off your observations, discussions with staff, any organizational documents. You synthesize that information from the external and internal assessments and use that to guide and develop your prediction and future of the organization. You can discuss key performance indicators, strategic plan of the institution, community health assessments, any identified strengths or weaknesses. And the prediction piece is a brief forecast of the future of the organization in the next 5 to 10 years. This is your assessment and analysis, but you do consider your assessments, your internal and external assessments, and any strategic plan that you've read or discussed with internal stakeholders or key leadership that you have interviewed or talked with during your clinical. And as I noted, you may use the SWOT analysis provided to help organize your notes and your thoughts, but again, it is not required.